The United Nations announced that the world population reached 8 billion on November 15, 2022. And based on Food and Agriculture Organization of the United Nations, the total number of cattle in the world is about 1 billion, and the number of goats in the world has exceeded 1.04 billion. Agriculture plays an indispensable role in our life. How much do we know about farming? How much do we know about animal diseases? There are many skills in farming. We should understand the prevention of animal disease plays more important role than the treatment. Disinfection, vaccines, feed and animal immunity are all important parts. How much can we do in the face of diseases? What we want to introduce to you today is a household necessity medicine, Barclean. Barclean Bacteria Clean. It made from sulfaminomethoxine, the wonder of sulfa. Barclean fight against infections caused by sensitive pathogens. It can work on the disease from animals' head to feet, including but not limited to meningitis, pulmonitis, gastroenteritis, mastitis, arthritis, and foot rot.
Many people say it is one of suffer drug, nothing big. However, I think Barclean is your first choice medicine on many bacterial disease. There is difference between the first choice medicine and the medicine of your choice. Let me take meningitis as an example. Suppose this meningitis was caused by bacteria. It was streptococcus. Can you use penicillin or oxytetracycline? Yes, you can. You know streptococcus belongs to gram-positive. These medicines work on gram-positive. However, the effect of these medicines are very limited. Because the head is too important. There are many protections. Outside there is skull, inside blood-brain barrier. Most medicines cannot break through this barrier, or the amount getting through is very small. Barclean can get through this barrier with high blood drug concentration and employ antibacterial power on focus. To bacterial meningitis, using Barclean to control bacteria, using diuretics to decrease intracranial pressure, using vitamin B1 to nourish nerve, always achieve good results.
Barclean Bacteria Clean.
Barclean is your first choice medicine because of its strong penetrating power. It can not only break through blood-brain barrier, but also blood-milk barrier. Many farmers feel mastitis is difficult to deal with because most medicines cannot reach mammary gland. It is easy to judge mastitis, which is characterized by red, hard, swelling, and pain. The milk is thin with flux or particles. Fever, depress, anorexia. In severe cases, movements totally stopped. There are blood-colored milk or yellow-colored watery milk, red conjunctiva, etc. Even cow may die of sepsis. If the acute mastitis is not completely cured, it will turn into chronic mastitis. There is no symptomatic symptom by this time, but the breast will become stiff with hard lumps in the breast with reduced milk yield. Mastitis can be easily treated by Barclean if discovered at an early stage by intramuscular injection. Barclean can not only reach mammary gland but also prevent systemic infections. It is safe to use Barclean during pregnancy. If not discovered at an early stage, and after the disease developed into the middle and the late stage, addition to intramuscular injection, topical treatment is needed. Firstly, disinfect the surface of breast and drain the corrupted milk out of the breast. Secondly, flush the breast with normal saline to drain out the pus. You cannot expect good results if there is a pus and very bad things fermented inside the breast, right? Thirdly, dilute 5 ml Barclean with not less than 15 ml of normal saline, altogether 20 ml or above, and then perfuse the solution into the sick breast once a day for 3 to 5 days. Complicated issues being easily solved. Now, let's talk about respiratory problem. Symptoms of upper respiratory infection include slight cough, usually dry cough without phlegm, runny nose, but secretion is clean, mild fever. Such phenomenon may be caused by common cold. It is virus disease. May attack your animal if the temperature difference between day and night is big. For example, over 5 degrees centigrade, or there is sharp weather change. Try Barclean intramuscularly. 2 candle, 1 ml per 10 kilo body weight. To sheep and goat, 2 ml per 10 kilo body weight. To lamb or piglet, 0.3 ml per 1 kilo body weight. For 2 or 3 days, animal can recover from cold virus relying on their own immune system because you have used Barclean, and the possible secondary bacterial infections are well controlled by Barclean. From the throat down is lower respiratory system, including trachea, bronchial tube, lung. If you failed to stop infections on upper respiratory, infections going down, symptoms here are always more serious. Nasal secretion becomes thick or yellow or rust. Cough becomes heavy. Even without stethoscope, you can hear phlegm sound in the lung clearly. Wheeze, difficult to breathe, high fever, no spirit, no appetite. Bronchitis, pulmonitis may develop. No panic, try Barclean. The dosage is the same, but you can give the double dose on the first day, preferable with 8 hours interval, and 1 dose on the following day for 3 to 5 days. If the case is urgent, you can give IV injection, because IV is a quick way after diluting Barclean with physical saline. Toward respiratory issue, there are several principles. Firstly, you need to make a rough judgment. Is it cold, virus, or it is a simple, non-infectious pneumonia because of a foreign material entering your animal's air tube? Or it is a bacterial infection but mixed with mycoplasma. Barclean is sensitive on both of them. Some farmers claim our Barclean is not effective. But when I looked into the matter, I found it was non-worm infestation. Of course, Barclean does not work on that. But you should know non-worm infestation always has non-causal situation, like anemia, emaciation. It is different from bacterial infection. Another principle is to treat on symptoms. Respiratory problem is not an isolating problem. It always associating with other problems. It is not easy to identify certain pathogens. Even other systems may affect respiratory system. For example, heart problem can lead to lung problem. Whatever causes, you deal with the symptoms first. If your animal cannot eat and drink, give them energy. Give the animal glucose. But you cannot mix Barclean with glucose. You can give infusion of glucose on the other side of the body, or infuse these two medicines one by one. If there is high fever, one side Barclean, the other side antipyretics. If there is obvious inflammatory exudation, one side Barclean, the other side dexamethasone. Good results always achieved.
Barclean Bacteria Clean.
Barclean can treat arthritis, in addition to acute sprains and non-inflammatory exudation. Streptococcus, staphylococcus, mycoplasma are also important reasons leading to arthritis. All these pathogens are sensitive to Barclean. Arthritis causes swelling and painful joints, sometimes create large amounts of fluid in the joint cavity. It can be seen in shoulder, elbow. If in waist, animal may suffer from laminalis and feel difficult to stand and fail to land. Arthritis may further cause systemic septic infection. Septicemia is a result of unfriendly germs entering the blood circulation, multiplying in blood and producing huge toxin, which is the direct cause of animal death in many infectious diseases. Barclean is very good to control septicemia. Let me share its application. To non-acute arthritis, non-acute meaning there is no obvious inflammatory exudation, no fever, animal can maintain normal eating and discharging, but arthritis does exist. You can administer Barclean intramuscularly, once per day for 3 days. Barclean helps the elimination of mild swelling and exudation. If there is obvious inflammatory exudation, swelling becomes bigger and bigger, there is sense of wave by palpation, then using an injector to draw fluid out of cavity. Many farmers like to squeeze pus, but this may damage blood vessel needing bacteria entering blood circulation, so squeezing is not recommended. Flush cavity with normal saline. You draw fluid out and flush until cavity is being completely cleaned and disinfected. Then dilute 5 ml of Barclean in about 15 ml of normal saline and inject the solution into joint cavity or cantle. To sheep, the procedure is the same, but you can reduce the volume of solution accordingly. You repeat this handling 1 or 2 times per day. Continue for 3 or 5 days. You may get good results. In severe cases, diluting some desamethasone together with Barclean to do cavity administration. Apart from such topical treatment, giving Barclean intramuscularly. This is not only to enhance the topical effect, but also to prevent systemic infection. Septicemia can be simply prevented by 3 days IM regime. The dosage can be varied according to the size of the animal. Furthermore, Barclean can be used as a blood therapy. You just inject Barclean at 3 or 5 points around the joint, about 2 ml per point. Barclean can release power around this circle to constrain bacteria in this area, and risks of overall infection induced by arthritis largely reduced by Barclean. Such treatment can relieve the hurt feeling, and animal may feel free to walk. Blood therapy can be done once per day for 3 or 5 days until your animal recovered.
Barclean Bacteria Clean.
I would like to mention that such IM plus topical application of Barclean not only works on arthritis, mastitis, but works on many others, like foot rot. You know, pathogen of foot rot belongs to anaerobic bacteria, which exists widely in the farms, soils, marshes, ponds. So if your grazing condition allows, better keep your animal away from low-lying areas. Based on hoof trimming, Barclean is your good choice, as it is sensitive to anaerobic debridement, disinfection of lesion. Then prepare Barclean into a 1.5% to 2% solution with normal saline. Then put medical cotton well best in such solution to dress lesion. You can change and replace such cotton every 2 days because Barclean is non-active and can last the medical effect for over 48 hours. Simultaneously, you can give Barclean IM to prevent systemic infection and in pursuit to achieve a better treatment. Does Barclean effective on gastrointestinal infection? Yes, it does. Let me share with you a small post about its application on bacterial intestinal infection of a lamb in Mbili Farm, Uganda, near Kampala.
Farmers under health management in goat keeping, we express a lot of challenge, and among the challenges, when we have diarrhea and high fever, most of our goats dehydrate. And when this comes, to save the goat, we are forced to administer liquid therapy to increase the fluid in this goat. And after, we are also able to administer directly through the veins the antibiotics to help this goat. Watch what we are doing and you will appreciate when the goat gets well.
I think the first procedure, we shall have to look for the jugular vein. At times it's not easy to a goat that is dehydrated, but keep it down.
We are getting the vein such that we administer the liquid therapy. This goat is now on drip. We are helping it to not to be dehydrated. Now, after we are going to administer the antibiotic to help the goat.
This is Barclean, which has a composition of sulfur and trifenthoprim. So it is good in stopping diarrhea in supplement with our usual tablets of S-dime. So after making sure that at least we have dripped that goat, normal saline, we shall put like 2.5 is sufficient for it. This drug it has 3 routes of administration: oral, intramuscular, and IV. But because our goat has been diureting for long, IV is the quickest way how these drugs can be absorbed. So that's why you have resorted to giving it to give it Barclean intravenously, and also to drip it because it has been dehydrated due to this long diarrhea it has been having. When we are giving IV, we have to make it slow. We push the drug slowly, because when you make it quick, you know the consequences of rapid infusion of IV drugs. They bring cardiac arrest. So we push the drug slowly. We shall have to put back our cannula. And we continue dripping it. So I think that's the whole process. We shall make sure that at least it takes some quantity of the normal saline so that it can get some energy, and also to make the drug move so quick in the body. Thank you so much.
Barclean Bacteria Clean. Barclean also cleans some type of protozoan. Easily solve complicated issues with Barclean. Barclean, a household necessity medicine. Be on standby.
So you people, for a kid's case, I told you, make sure that you have the sulfur drugs. Like in season of production, have the sulfur drugs, have Barclean. Be on standby with sulfur drugs. I use Barclean. If I give it orally, it does a lot of wonders.
Barclean, the latest generation of sulfonamides, is proudly produced by Feng Tong Animal Pharmaceuticals. Please contact Farmers Center Limited for more details. Call 0774 100 200. To take care of animal health is to take care of ourselves.